So yeah, there's an acronym within an acronym, but we can get past that. So our team is comprised of a quality improvement decision support specialist, or 3 of them from Ontario. I'm one of them. We optimize EMRs, electronic medical records, and we streamline healthcare and primary care clinics in Ontario. And we work with a physician. We have one on our team from acute and primary care, and we have a knowledge translation expert that supports 186 clinics across Ontario. So what is COPD? It's chronic obstructive pulmonary disease. It's a progressive lung disease, and it's significant. It impacts 4% of Canadians and US citizens, and it's very expensive to manage. So what are the challenges of COPD? It's engaging patients, it's early intervention, and it's having patients adhere to some of the lifestyle and medication changes they need to make to maintain quality of life. So current COPD apps, there are some that exist out there. They haven't been evaluated formally. They lack comprehensiveness, and they lack also the ability to integrate with EMR, so the information going into the app doesn't transmit into an EMR for the provider to see and act upon immediately, and that's because they're free text-based, so the data is not structured in such a way that the information can be utilized. So what are we proposing? Our team is proposing to design an app that is structured in such a way that it can transmit to an EMR because of our experience working with EMR. So we know what you need to work on in order to make that happen. We know who to engage because we work with those stakeholders. We also know what the physician needs to look at to get them in. So it's very difficult to book immediate follow-ups because sometimes you don't know the urgency of the patient. This is what the app's going to look like. So the first step, the physician would need to prescribe the app to the patient. The patient would need to take a validated assessment tool, validated by the Lung Health Association, so that they take a baseline score. Then, if anything ever flares up, they would take the I Feel Like Crap app. It's 6 questions, and it helps them trigger or identify if they need urgent, immediate follow-up with their doc. We need to make it fun to increase uptake. So they call now, and then they can book their appointment. We just need to engage these providers, these stakeholders, so that we can get the ball rolling. They're talking about it, it's a hot topic, but it's not exactly there yet. Okay.
Thank you very much. I'm going to use that mic so it goes to live stream. So I'm going to pass it on to the judges who can ask questions of these.
So how will you work to integrate with the EMRs of various different hospitals that may use different systems?
So this is for primary care. So we work in primary care settings that use electronic medical records, and the way we integrate it is, so we work with the vendors. We work with a lot of vendors, different EMRs. And what we would say is, this is how we think it needs to work. Why? Because we see like things happening in the EMR right now, so you need to do something similar to this. Like we would use an example, because we know what would work and what wouldn't work, and then we kind of then apply it to this, to say, and this is how you would need to use it in this context to make it work in your EMR. Because we know exactly what would and wouldn't work, and most people don't know that, so they can't apply it the way we can. So we use recommendations like that.
At what stage in the development do you intend to get the patients that are having the COPD involved?
I'm sorry, can you repeat the first one?
At what stage in the development do you want to get the patients that have the COPD?
To use the app?
Yeah. No, actually, get
involved. Involved, you mean to use the application to...
get a sense for how they're going to use it, what is the real need, just instead of...
Okay.
In your development.
And then, in the development. So at the end of the slide, I didn't pay too much explanation, but the idea is when we engage our stakeholders, one of our, and I didn't put this, is the patient is one of the major stakeholders. So when we design it, we do some testing. We see a lot of what we recommended in the app there is based on tools that exist and have been validated, and they've already engaged patients, but I still think it'd be worth it because it's a little bit different to make sure it works.